So welcome everybody. It's Monday, September 2nd. It's the Cancer Conquering Community. My name is Boyd Dunleavy. I co-moderate this meeting with Mark Kagiyama. We're gonna have a guest speaker tonight coming on in a little bit, but first of all, we're just gonna pass this over to Mark. Our friend Dave has been on for the past few months advocating for his son Tyler, and we got some sad news last week. So Mark, do you mind just briefly sharing what happened with Tyler? If you could unmute, thank you.
Yes. I originally met Dave, and for those of you who are active on LinkedIn, you might have seen his posts. And what he started doing was he was posting about his son Tyler, and they call him the TIE Fighter. Tyler was 16 years old, and I never met him, but I had quite a bit of interaction with his father, David Robbins, and Dave started posting about Tyler's progress on LinkedIn. And I mean, it's been an absolute roller coaster. I mean, for this family, my heart goes out to this family, the Robbins family. And what I want to do is, have a tribute to his son, Tyler. Anyway, what happened was he has he developed cancer, and this was his second bout with cancer. And the family and his father Dave did everything, everything absolutely humanly possible to save his life. Tyler was an adopted son, and he is of Native American heritage. And so he had blood cancer, and then it developed into other types of cancers as well. And so they went to the Indian nation. I don't recall the name of which nation it was, but they went to his birth family, and his birth family refused to assist at all. And then and so they were, not happy about that, but they were willing to move on. Eventually, what happened was the Indian nation said, "Hey, we're gonna help you and try to find a donor for you." And so they came to their assistance, and about 10 days ago, roughly, may have been 2 weeks. I don't remember the exact timeline. But Dave came on LinkedIn and came up with a post and said, Tyler is being evac'd from their home in Utah to Seattle. And they had a doctor there that was supposed to perform some kind of procedure. And and I'm going to interject something that happened to me personally this past Thursday. This past Thursday, um, we got a call from my daughter, and our granddaughter, who is a little over 10 months, her name's Peyton Rose, uh, had an accident with the babysitter. She was on the changing table, and the babysitter turned her head, and the baby fell off. It was about 4 foot high. And they have a video in that room, and the baby fell straight on her head from about 4 foot tall. And so as soon as I saw it, I said, we're going to the ER right now. So we all rushed over there, and her father is a policeman. He rushed home, and my daughter, she was coming in from a flight, and she met us at the hospital about 10 minutes after. And so, as it turned out, thank God. I mean, and we were praying really hard for a miracle. everything turned out to be okay. And, when I saw her, she was normal. She was, there's no swelling, no fever. She wasn't throwing up. And so we were very, very hopeful at that time. And so when she finally saw the doctor said, she's okay. So what happened was, we got the news, we left the hospital. It was after midnight. We got home, and so I opened up my LinkedIn, and the first thing I saw, and my heart just dropped, is David Robbins posted that his son had just passed away. And I mean, it was like we went from, the highest of high to the lowest of low, because I had been, we had all been praying here in fact, Dave is a member of our cancer counseling community, and he shared Tyler's story a number of times. And to see that was just, I can't even express what that meant to me. And I know some of the rest of you as well. So what I want to do, in fact, I'd like to ask Claudio, even though uh, he didn't know him. Claudio, could you lead us in a prayer and then a moment of silence?
Sure, sure. I'll be delighted to.
Thank you so much.
Very welcome. Lord, as we appreciate the gift, the incommensurable gift of life that you're giving us, especially to the one of us that are afflicted by cancer, please, for a moment, divert your attention on this young soul that had his life, unfortunately, be a very brief moment, but an intense moment. For many of us, he has given us the opportunity to pause, to reflect, and once more, understand the value of this gift of life that you bestow upon us every day. Please, Lord, stay close to their family. This is something that is very difficult to understand, to accept, and to deal. But as you give us the gift of life, give their parents the gift of acceptance. Allow them to be at peace and know that the memory of Taylor would be something that will be in their heart, in their action forever. Amen. And please, just let's stay silent for a moment, connect to the beautiful energy of this child, and we wish him that his light will continue to shine bright and his journey towards the light of God be serene for the benefit of all sentient beings of past, present, and future. Lord, bless us all. Thank you. Amen.
Amen. Thank you so much, Claudio. Boyd, would you like to add anything?
Yes, this is for Dave, but also Claudio. So I'm a two-time survivor of blood cancer myself, of leukemia. And it's been 13 years now, and by God's grace, he delivered me of the blood cancer to even have a transplant. And so leukemia is a horrible, horrible illness that I'm not trying to draw attention to myself, but just Mark asked if I would share something. You know, I've lost friends before, and it just breaks my heart. And I know if John Brent were able to be here, he's also a leukemia survivor and a childhood cancer survivor, and so is Jessica. She's had childhood cancer, and so Tyler, we agree with Claudio's prayers that he would be at peace and at rest, and I just pray for peace for the home, and just even rest to Dave's spirit and his wife and family members. That we pray that Tyler's in a good, safe space. And Mark, thank you for the opportunity to allow me to share. And I know I speak for the other folks that are in the crew that aren't here tonight, that this one always hits home. So thank you.
Our speaker, Dr. Nhu, is, she had mentioned that she was trying to get home. Dr. Nhu, are you available yet? Or how much time do you need?
Yes.
I am almost arriving, and I just a moment of it's just so sad when I hear the story, not only of what the family have gone through, and even though they tried to reach out to the biological parents, and the biological parents weren't even accepting and just do whatever. It just really disheartened to hear that. It's so sad for life, no matter what. I just see that that is why collectively, and of course, I just know individually myself, is that I know all in here, everyone's in here have a big heart and a big, kind, loving, and it just we have to be able to reach out and have more impact of not just even any illness, but cancer and all. That's when you have to be really go above beyond that kindness, that grace, and no matter what the past is, you have to leave it and center toward how can I be able to help, to be able to support, how can I be more present. And it just I don't know, it hurts me to hear that. And and then I know that Mark shared that he was his grand baby of 10 months fell, and thank goodness that she's okay. I think it's granddaughter, right, Mark?
Yeah, it's his granddaughter.
But it's also
Yes.
a reminder that life is so precious, that someone go and someone is safe. But I think during the time that we are blessed to be around is how we can share the collectiveness of loving kindness and really be there for one another. That's more so than ever of our community to be stronger. It's more bond, and that is why I totally see that when someone really care for their patient, for their well-being, because that is where we don't get to choose to say whose life is it worth to save, right? Whose life is it, no matter what happened in life. And that's the thing that I think is to really realize that we're all in this together. We're all one family. It doesn't matter what the biological or not. And it's just so sad. And
Yes. Dr.
I'm just
Nhu,
speechless. I'm so sorry. It just
that's okay.
it
Thank
takes
you.
me
Thank you for
and
sharing. We're
a
just
little.
wondering, how long do you figure before you can come on and do your
Oh,
presentation?
just give me a maybe 2 minutes so I can get my laptop up and I'll walk
Okay.
in and I'll be ready. But yeah, I just wanna, just kind of share. It's just and then for those who know his dad personally, something in the spiritual that I would say if it was my family or anyone is that within 49 days of someone passing, no matter what the cause, and right now we're talking about cancer, of any illness that cause our family, our loved one, our friends, what we can do collectively is within 49 days of them passing, any collective good merits that we're able to generate, we can dedicate all the good merits to the person who passed away, and so that way they will be in a better place at more peace. That's what something that I would like to share, whether those who are here believe it or not, but that is the power of us that we can do. And that's something that I think will also help the merit that we do every day. So thank you for sharing your story, Mark, what happened, and of course, what happened to his son. It's so lots of prayer for him, his family, and all those who are affected who know him personally. So thank you for sharing, giving us space. Thank you.
Thank you, Dr. Nhu. Why don't we just pivot for a moment? Mark, do you want me to pause the recording till she comes on, or I can pause it? Or just keep you're muted. Keep it going.
Yeah, let's just keep it going and keep it
Do you want
moving.
to talk about anything upcoming in the next few weeks since we're waiting for Dr. Nhu?
Yes. Next week is what we call an open week, and that will be let's see, September 9th. And then the following week, we have another speaker, and that will be Julia Fox Garrison, who's just absolutely incredible. She's an author and a speaker, and has an incredible story. And I know that everybody will love her.
Didn't she share
She's
it
just
in March with her?
yes, she
I
did.
remember her. Yeah,
Yeah,
she's good.
She is really, really good.
Are you
And
impressed that I remembered that?
Yeah.
She was great. She was really good.
Yes, yes. And Claudio, you were, if you wouldn't mind unmuting,
We just
when
muted
Dr.
you while
Nhu
she was
was,
sharing, but if you could unmute her.
yeah, when Dr. Nhu was sharing about the 49, you kept shaking your head. Yes. Would you like to elaborate?
Yes, because I've been practicing Zen Buddhism and Zen mindfulness for 35 years. It happened that just 3 days ago, we did the send-off ceremony for someone who passed with cancer at that on that day, 49 days. It's an old Buddhist tradition. And for those of you that don't have experience, it's a beautiful one because you do meditation, you do sitting meditation, you do walking meditation, which is called kinin. And then in between prayers, you talk about the person who passed, but in the present tense. You're not allowed to use the past tense. And that forces you. It's another dirty Zen trick that forces you to be in the moment. to be very careful about what you say. And by speaking in the presence, you convey this sense that you are really shaking hand with the person and say, it's okay to go. And all your merits that have been will go with you in the journey. And it's, unfortunately, we have done many throughout the years because the impermanence of life is unquestionable, and we come and go. And so, but it's, I was so happy to hear that by Dr. Truong. It just happened that we did one of those ceremonies.
What was your friend's name that passed?
Greg Thompson.
Thank you for remembering Greg.
Yeah. And every Saturday when we do our sitting, we also chant for the safe passing of anyone who has passed, and for the well-being of other people. So we usually have a very long list of names, and that helps. And a few times I've done it at the hospital where I work as a volunteer, and some people are very touched because they are involved in the pain of a loved one that has cancer. And when they hear that, and the ability that one day, when the inevitable will happen, you know there is someone that is remembering you, it gives you a lot of comfort. That's part of the compassion that I teach, the mindfulness, both in corporate and in hospital environment.
Thank you for sharing.
You're welcome.
Mark, go ahead.
Why don't we say hello to Pamela?
Yeah,
Pamela,
Pam.
would you like to unmute and tell us what's going well with you and any thoughts you might have?
And how's your grandson?
Hi, can you hear me?
Yep. How's your grandson?
Oh, good. Okay, my son redid my computer today. I've got 2 screens now. I'm moving up. I'm so sorry to hear the sad news. I'm so sorry to everybody that knew him, and of course his father and parents, and what a terrible thing to go through, as we all know. When I get a little touch of survivor's guilt, I only let it sit for a second or two, and then I remember God's got more for me to do here. That's why we're all here, because we've got more to do. And this young man was ready. He was ready to get his wings. So I just, again, so sorry to hear this. I'm doing great. Everything's good. My grandbaby's 2.5 now, so I am keeping thin because of him, on the move, and I'm enjoying every minute of it, and just grateful to be here tonight with y'all.
Thank you for joining us.
Dr. Nhu, are you ready to come on yet?
Yeah, I think she's coming back in with her laptop. And I think she's joining us. While she's joining us, Mark, I think most people know I'll be heading to the Man Up to Cancer gathering, which is coming up this week. In the Poconos in Pennsylvania, I'll be meeting John Brent for the first time in person, as well as Ross McCreary, who's on mute on the call. But a lot of guys that I've got to know through this community actually came through the Man Up to Cancer group. So it's our 3rd annual gathering, and I'll be meeting about 200 guys in person. But without further ado, Dr. Nhu, whenever you're ready, please feel free to turn your camera on, and then we'll go from there. Hey.
Let me turn off the phone so we don't hear the echo.
I'll just remove the phone. There you
Yeah, I think, right? You just one now?
go. Yeah, just one.
All right, let me turn on the volume. So sorry.
Welcome.
It's one of those days, and I think thank you for the grace. And I love that. I think it was Claudio was mentioning about the prayers and the mindfulness and the meditation, or the Buddhist a little philosophy, but it's really that I really do see that the impact of prayers is so powerful. And that is why I know the only guilt is always the little soul that always, leave is how the family member, that was what touched me. Of course, when it's time, like Pamela mentioned, is his time. His time here is done. And so he is in a better place. It's just for us, it's the detail that we kind of hold on to and wish that it could be a better outcome doing when he was here. But that's not ours to do or to judge and to be able to support and move on. And how do we support someone in their journey? And I think that is something for me. Just a little bit of I want to share why it's so important, and I think it's perfect topic for us to really dive in today on why the concept, of what we talk about mindfulness and the
Hey,
impact
Dr. Nhu,
on.
before
Yes.
you get going, could you tell us a little bit about who you are and for everybody, Dr. Nhu is to me is the doctor that we all wish we had. And she is just special, absolutely special. I mean, I just absolutely love her. She's just got such incredible insight because she sees it from both sides. So if you could tell us a little bit about who you are and some of the experiences that you had, and then get into your topic, I'd appreciate it. Thank you.
Well, thank you, Mark, and of course, happy Monday, happy Labor Day for everyone, and thank you, Mark, for having me, and Chaplain Claudio, Pamela Boy, Stephen, Ross, and Michael. I believe I say hi to everyone. And about me, who I am, and it's really, I think Mark always give everyone the kindness, the warmest, and incredible welcoming. And really, I'm not special. I'm just someone who I see things a little differently, even though my age doesn't really see, but I've my heart, and I guess maybe my past life, because I believe in past life. I am a little different, and my philosophy and who I am is really, I'm a clinical pharmacist by background. I have a doctorate degree in the pharmacy. I've worked in clinical rounding with physicians and consultations to ICU, to hospice, or to the last stage of life, hospice. And I also see, um, trauma to illness to cancer and little kids to adult or grandmother age. And one of the things that really I see the lack of is that the respect and dignity as a patient and their family being treated, no matter if it's based on color, religion, or economical, financial status. I do see that it is a long way, but for me, I see is that what I do every day to really spread the loving kindness and empathy and compassionate for someone is that, especially in during the journey of anyone going through an illness, and not much talk about cancer, but it's being able to have sympathy and empathy and really hear it from their point of view, hear it from their pain points, hear it from their struggles, not just what you expect, what you read in guidelines and studies and what you've seen. And I think treating someone uniqueness as who they are with respect and dignity. I've seen a lot of numbness in the system that makes me kind of not wanting to go with the flow, go with the system. So that is why, not only through my own journey of having sepsis and, family member loss, like my father through cancer, my other family members are survivor of cancer, but seeing on both sides of coming back, seeing how providers can also, nurses, doctors, pharmacists, any of those healthcare provider, if we're able to put ourselves like they're our family member. They're our mother, grandmother, kids, or nephew. The way we treat someone will be different. And that is how, I don't know why it's so hard for others, but for me, it's so easy because that's who I am. And so when I try to lead by example, it's like, it's not hard because you have to put your heart and soul. You want to serve, you want to go above and beyond. It's not someone that tells you, well, you have 3 months to live. Would you like that if they just tell you that way, right? And I think that is being able to have that, like culture on everyone. I know that everyone work hard, but you have to, that is how I see that change, giving patients hope that there are people out there care for them beyond just not a number, not about money. And I think that is where holistically, for me, mindfulness has changed my life because of, I think, not think, I know that in this lifetime, we all suffer, right? Suffer from illness, suffer from loss, suffer from family, or loved ones that are died too soon, that they have a lot to do. And I think because of so much suffering, I want to be able to find a way and dive in to say, what can we do outside of the norm? Not just like a pill for nail for every little thing and just be addictions and feeding into the monopoly of just the money system, right? And the sick care. So I am very advocate for a holistic approach. I'm not saying that there isn't a time or place for medicine, but it has to be something we have to be really careful and considering. And for me, that's how I would stand. Um, you know, and I think kindness is a small act, but it goes a long way to not only touch life, but also impact the way they will strive to live not only now, but ongoing and their kids, grandkids. And that is something that I think is missing. And I would like to kind of pass that message to others. So I'm very, humble, honored to be here. And with our topic of, mindfulness and having compassion and having that positivity mindset, what would it do to our cancer patients, our cancer family member? How would it change our survival, right? To heal and not just heal on the outside only, but heal from the inside out. And for me, that is something spiritually, I kind of put that all, weave it in, but not leave anybody behind, considering the healthcare providers, the patients, the family. Those are all aspects that we have to be able to raise awareness and have the education on. And so that is a little bit about me. And Mark is just too kind, of course, boy, and everyone here. And so it's really my really dear to my heart to be able to be here to share with you how mindfulness have changed, shift, like for instance, to tell you a story of a patient interaction when she had cancer of breast cancer, newly diagnosed, or any other, is the fact that we can show them to focus on breathing. And sometimes we think that breathing is so simple, but really do deep breathing and let go of everything else. And the pain and the suffering and the focus of wherever we focus, it grows. So when we have gratitude for the life that we have, it only drastically change exponentially for the patient, their family, and their suffering is much less. And I've seen that, in when Chaplain Claudio mentioned about when patients are in the hospital, one of the things that I think if those who are listening for us later in on the replay is that even if we are interacting with someone who are at the moment of passing or already passing, but even our thoughts, when we give prayers in our thoughts, it also gives merit to the person who are fighting the illness, suffering, or even after they pass. because after the 49 days is when they really gone, right? Transform into another life is how we view it. And so that is something that for us, if we don't feel guilty, don't feel like, oh, like I think Pamela mentioned, she feel guilty for being the survivor guilt. And you shouldn't be, because it's, I think everyone here is here for a purpose. And that is something that I truly believe, that we are here for a reason, and why we're here collectively. Sorry, anyone like to chime in so that before we kick off, anything that you have personally experienced in mindfulness? Just curiosity. I know that Claudio mentioned. What about Boy or Pamela, Stephen, or Ross?
Thank you for sharing, Dr. Nhu. Mark, I'm not sure what you wanted the format to be, but if anybody wanted to jump in with a comment or question for Dr.
Yeah,
Nhu.
So I
let
know
me
what
just
the
jump in
context.
real quick. I just
ahead.
wanted to say thank you to everyone. I've got to get going. I should have been off like a half an
Aw.
hour ago, but I wanted to stay because of the incredible people here. But I do have to go, so I'm going to hand it over to Boyd.
Thank you.
And thank you so much, Dr. Nhu. Thank you, Claudio, Pamela, Steve, everybody else on the call. And we'll see you next week. Take care.
Well, you
Bye-bye.
can see how I do by watching it later. Thanks, Mark. Take care. Okay, so since I'm now the host, a couple things. One, she did open it up. If anybody would like to unmute, just feel free to unmute and chime in. Chaplain Claudio, would you like to share something, sir?
As I always say, having gone through cancer twice, and the second time was a real scary one with the pancreatic cancer. I always say that the practice of mindfulness, it's what kept my sanity and helped me to help myself, to help my wife cope with the difficulty. Because as Dr. Truong was saying, the action of mindfulness, I always say that when you do a good deed in life, there are three categories of people that benefit: the doer, the receiver, and the person that passes by, which will repeat that act down the road. So I found myself at the first, after the first infusion, mind you, this was in the midst of COVID, of going cubicle by cubicle and trying to share with people that were really suffering. Some were very angry. And I said, why you putting a head on top of another head? Cancer is already horrible by itself. If you putting a layer of cancer, a layer of anger, it's going to be a disaster. And that's why I always say, when you get diagnosed with cancer, never ask yourself, why me? Because the answer is too stupid, too simple. Why not?
Mm.
We are here according to something that Buddhists call karma. We have accumulated this karma. So we have a path that we have to follow. But the beauty is that while we follow that path, there are so many other branching streams that cross over. And so we make this journey collectively. And that's where we get the power of healing, to help people. And again, we use in Buddhism an expression, our vow is to relieve the suffering of all sentient beings during our journey. So the power of mindfulness, it's we could talk for weeks, not for hours. Thank you.
Thank you, Chaplain.
Oh, thank you. And I know that we're short on time, and a lot of people I value your time. And one of the things that we can talk about, but one of the things in the effect of mindfulness on the studies and the body, meaning during a cancer journey, what the physiological and the physical effects of practicing mindfulness. When we focus on the present moments right now, let's say we have a headache, stomach ache, pain on the leg, arm, whatever it is, But having practiced mindfulness is like hitting a pause button on all the worries about the future of what's going to happen and the regrets of the past. And when we allow ourselves to fully engage on what is happening right now, the stress of the anxiety, the unknown, or the immune system response when we practice mindfulness is the deep breathing, not just like really deep breathing, even walking, the walking meditation, mindfulness, and just be aware of all the surrounding, the beauties. Or if you like to close your eye, on practicing, but your bodies will reduce the amount of cortisol that your body stress hormones that will, normally it will be really high, but those when we practice mindfulness, your body will be able to fight off the cancer cells by reducing that cortisol level. And that is also how we can help boost our immune system. So some ways those are like a natural, when we talk about herbals or like vitamin C, mindfulness is your dose of that vitamin C to boost your immune system. Of course, you want to take walks in the sunlight to help with the vitamin D and all, but it's be able to be a part of nature, to be aware of that that is the circle of life. And also with mindfulness, it also lower our blood pressures. If you notice when we do deep breathing and meditation over time, if you keep track of your blood pressure, you will see your record of blood pressure dropping consistently. And so, there's studies of high blood pressures oftenly linked to stress induced or can strain the heart or in other organs. And so those are scientifically also, we all know what stress will induce and cause a lot of things, even cancer. So by keeping our blood pressures in check and practicing the deep mindfulness and deep breathing, we also, it's part of our cancer treatment, is how, I know a lot of cancer patients also endure a lot of pain. And so when you require a lot of pain medications, you feel like you also need to up the dose. I need more and more because you tolerate, it's, you cannot tolerate anymore. But if you practice the mindfulness, if you jot down what is your pain level before or after, if you start practicing, you will see a tremendous value if you log a journal, and you will see the pain points, like the sliding scale, like from 0 to 10, what that pain will be like after. So having the mindful breathing and the body scan and really learn to observe like our pain, but when we meditate, having a meditation, whether it's a mantra meditations, whether it's praying to Buddha or God, but we focus and heal in that spot, you're going to see a lot of things transform over time. Is that, and you just let it go and not focus anything in your mind, you will see that you're not focusing on the pain point anymore. It become something magical, is something that I can't explain, but I think that once you practice, you feel like your tolerance and resilience and endurance will increase. And you are able to tolerate it more because you are blessed. You have this gratitude feeling of, I have this life that I get to be present here with everyone, no matter what I have going on. It does not define who I am. I think we have to not only change the narrative of how we got cancer, how we are here, because sometimes in our mind, it also messes with our emotional, our physical bodies because of what we feed into our mind, like, oh, I did this, therefore I have that. I know that psychological, we have to also, for me, it I don't know what others is that also incorporate with having the gratitude, but also they call it repentance, like you please forgive me, whether it's God, Buddha, whatever my past wrongdoings that I knowingly and unknowingly have done for others. And when you really sincerely pray and move forward, meaning whatever in the past, let it go. But moving forward, the moment you choose to say, I no longer, and whatever you give up on, you will see your transformation, because it's like you taking a vow that you are now a new, like I call like new. I am new, but I'm a new person. I'm no longer the old version of new, and I'm letting go of this baggage that I kept. And that's one of the things that, not sure how what others have experienced, but that's one of the things that, as I kind of encounter and go through what some of the patients struggle, is the guilt of not being able to do the activities that they were or in the past before the cancer, and saying, I wish. And so they are still hung up on the past. They're still hung up on, I'm not able to do so. So they're more frustrated themselves. So we have to be willing to let it go. And this is your new identity, is not the old version. The new identity is who you are, what makes you so grateful to be here, and what are your message for your family, your friends, is going forward. And that will change how the healing journey, and how you let go of the guilt that you're not able to be there all the time, out in the sun or out in the car, right? Whatever it is that you feel like you need to, that is the expectation of, for us, is like letting go of the wants. Sometimes you just have to be in the present, and just not expect too much, because when you expect from others, or even expect from ourselves, we always feel like we haven't done enough. But you have done enough. You have gone through so much. You have to give yourself grace like you give to others. And I think that's something that, it seems simple, but a lot of time we're not willing to acknowledge that we do have that. We do have that control, or that ego, like, I need to do this. I'm not able to, so why? So the anger and the frustration manifest in a way that are not kind to yourself, and in others, it makes others kind of turn away. So that's something I think for us is like, um, don't expect from others, and don't, just let them be, because when people are meant to be around, they will be around. And when they're not, they're not ready. It's not about you, it's about them. Their insecurity for not be able to deal with it. And so those are things, it's a tough ways to say, but it's the only way. We just have to not, and that's mindfulness, is coming back to not judge others, and not putting that lens of framework of, this is the expectation, this should be. Why do we have to hold on to, it should be this way, right? And that will change how we view, does it have to be this painful? Does it have to be this long? Why do you change? Why do you have to say it like that? So for us, like, we have to go through in our own head. It's like, aren't you glad that you're able to have this slow moment of time, not able to work, be present with your family? So there's another way that we can change our viewpoint of where we are. And it's up to us to choose to say, oh, I'm blessed to be able, thank goodness I have this, but I'm still here because my family's all here, my kids, grandkids, or whatever it is, but all the beauty. So it's being able to have a positive mindset, even in the most struggle moment of time, will change the way you're healing, and the way you view yourself and your journey. And when it's time to go, you're more at ease. And so that is something that I wish that for all those who are listening now, I don't know if anything that kind of trigger or activate any pain points for you, but I am sincerely wish that, for all those who are here and are coming across our path, I always wish for no one to be in pain and suffering to always be healthy, be happy. We're full of love and joy. Know that they are loved, that nothing is wrong. It's just a process that we have to be willing to go through, even though we don't know what our past life that we have done, but we have to be able to accept it with happiness and not hold a grudge like why I have to have this. But if you feel like now you have this, what are you able to do, as in bless other people? What can you do that makes it lighter on others? Is that it's part of who you are. It become of who, it's like for instance, someone who lose hair versus people who have a lot of hair. So we always judge, well, oh, I'm so bald and I have less hair, I need to do this, or like makeup. Oh, I don't have makeup, I need to put on makeup. It's our own viewpoint of what is supposed to be. But that's not how it's supposed to be. Maybe our lifetime is this amount of lifespan, 5 years, 10 years, 40 years, 50 years, 60 years. Some people one day, but it's the time that we are well lived in a moment, in the present moment. And
Dr. Nhu.
when it's time to go, don't hold anything, the baggage, the hurt, you have to let it go. And that is something, it's hard, but I've seen people who, at the moment of letting go of their family members, when we cry, we feel a lot of negative emotion come up, like we are so attached to our loved one that, oh, I don't want my loved ones to go, please stay here. It also hurt them because they don't want to go. So that is something that we have to train also to practice, like Claudio's mentioned, the life is impermanent, so we always have to visualize that this life that we are blessed to have is, even though we think it could be 100 or 90 or 60, however that we think we're X amount plus that we have, but it goes by like this. It's very short-lived.
Dr.
So
Nhu.
when we practice impermanence, everything change, and we're blessed to practice. And
Can I
really,
interrupt for a
yes,
moment?
sorry,
So
boy.
thank you. Yes, you did wonderful. So we are at the top of the hour. And we're going to turn the recording off in one moment. So my takeaway is 1, acceptance, 2, serenity, B, letting go, C, I don't know, it just reminds me of like going to Disney and seeing the movie Frozen, just let it go, and things like that. But anyways, what we're gonna do, just because we're at the top of the hour, I do want to respect that, and thank you. I'm gonna turn the recording off again. This was Monday, September 2nd. It was an interesting meeting, just remembering Tyler that had passed, and Dr. Nhu, thank you for sharing. We're not gonna stop now. I'm just gonna stop the recording, and then from there, I'd like to invite you guys to open it up to any questions, or if Dr. Nhu would like to continue on. We just want to respect the hour. So I'm just turning the camera off now. Thank you.